Senator.
Thank you, Chairman Schwertner, for your presentation and the hard work you all did with respect to Child Protective Services, behavioral health, some of the other matters that you pointed out. I just have a few questions, well, a couple of questions, although one of them is in a little bit more detail with regard to the Medicaid children's therapy services. But first, let me ask you this. Have we made a public pledge to meet the Medicaid needs in 2019? Because we know we're going to fall short this particular budget, but have we made the pledge to meet those needs in 2019 if appropriated funds are not adequate? So that's one part of the question. And the other part is, and also have we made a pledge to not cut benefits, eligibility, or rates for Medicaid?
Well, Senator, as you know, Medicaid is an entitlement program, and certainly if you are eligible for that benefit, the state of Texas is going to be provided. So yes, we've made a pledge. The amount that we budget for Medicaid is a projection made by the agency, a projection made by LBB. Sometimes those projections, if you have a good economy, are actually too high. Sometimes if you have a bad economy, they're too low. But in the end, yes, if a Medicaid individual needs services and they qualify for those services, we are going to offer those services and provide those services.
It's my understanding that we're going to fall short of anywhere from $1 to $2 billion, and we're going to have to deal with that in the next biennium in our supplemental appropriations. Is that correct?
That is the typical way the budget is done regarding projecting into the future of the cost of such a large entitlement program. There's always some level of uncertainty regarding that projection, but I believe this is a fair estimate of what Medicaid costs will be over the next biennium, and certainly if there are costs that need to be paid for, then we will do so in the supplemental budget when we come back in 2019.
All right, thank you. Now let me just move on then to the Medicaid Children's Therapy Services. There was a lot of discussion about that, as you know, during the interim when the cuts were made during the regulatory process. There was a court case on it, and many of us were looking forward to, in this session, having a budget that would restore some of those cuts, given all of the information that we got regarding that program. Am I correct that House Bill 2, as passed from the House, included several provisions related to these therapy services, including that they would provide in the House budget $21.5 million general revenue and funding in order to reverse the 2015 cuts, which would have been about a 50% restoration of rates? Is that what they had in the House side?
You're referring to HB 2, the supplemental bill?
Yes, sir.
I believe that is what was passed off the House floor. That is not what was finally voted on, obviously, as the conference report for HB 2 yesterday or 2 days ago when the House finally passed HB 2.
Right, and did that House version of House Bill 2 also repeal language that is driving additional therapy payment cuts, including the HHSC rate hearing this week?
One more time, Senator, I don't understand your question.
Did the House version also repeal language that is driving the additional therapy payment cuts and including an agency rate hearing this week?
Yes, there was an agency rate hearing this week. I believe the concern regarding what the House tried to do in HB 2 was that there just wasn't enough time to go through the adoption of rules and the rate setting process to change anything during this current biennium. But looking forward, Senator, what this budget does with therapy rates is a restoration of 25% of the Rider 50 therapy rate cuts that were done under the 2015 budget. In addition, this budget has a phase-in of the reductions that are part of the therapy policy changes that are currently scheduled to go into effect July 1st of this year. So there are two provisions that directly affect reimbursements. In addition, there's a reporting requirement through Rider 215, which aims to continue to collect data on the network of therapists and therapy providers and any potential access issues that will help us generate additional information over this biennium to ensure that we are accurately capturing access to care issues if there are any.
Okay. So what we ended up with was a 25% restoration, as I recall. Didn't House Bill 2 provide for 75% restoring of cuts?
I believe that was 50% actually.
50%?
What was the Senate version or the House version of HB 1? Or
okay. Is the agency, Health and Human Services, going to be free to move ahead with more, even new policy changes to further cut therapy payments?
The agency has, obviously hearings regarding rate changes and has input from stakeholders, but the changes in this budget, again, are a restoration of 25% of the reductions to therapy rates, as well as a phase-in of certain policy provisions and reductions that were part of the therapy policy changes that were currently scheduled to go into effect as of July 1st of this year. Both of those would be viewed as positive for providers regarding their reimbursements.
Well, let me ask you, with all of the, there was a lot of public testimony, media attention from parents struggling to get their kids the therapies they needed, and they held press conferences, they went before the Finance Committee. Can you tell us why the budget conferees opted not to adopt the House supplemental bill language and, as I understand it, a 75% restoration?
Yeah, that's a good question. And it boils down to, are we actually seeing changes that directly affect access? And Senator, I've been monitoring this very carefully. HHSC has been looking at the implementation of the rate reductions from November to March 22nd of this year, and there have been only 7 substantiated access-related complaints. So the bottom line is, and we discussed this very carefully during the conference committee, is that, yes, you're hearing a lot of noise from provider groups, and they are generating certain patients and families to testify. But when it comes down to the actual access issue, we're not seeing the numbers that would cause great alarm. But that said, we're going to continue to look at it. And that's what, again, the Rider 215 speaks to regarding the continued collection of data to make sure that we're not affecting access to those that need care. But I think we need to be very judicious with our taxpayer money and make sure that we're paying a fair rate, one that is commensurate with the service being provided, and at the same time making sure that those that need the care get the care at the appropriate time, appropriate setting. But I'm not going to just suggest that we need to restore rates because provider groups or individuals connected with them come up here and testify. I want to see hard data that there are truly issues associated with access or the provision of network adequacy that needs to be addressed.
I think we can all agree with that. I think that's the right approach, as a matter of fact. So, one last question. What process will we have to ensure that the Medicaid cost containment targets in the Commission Rider 36, which calls for $830 million in cuts, do not have similar harmful effects on children and other vulnerable Texans?
You're referring to the current cost containment rider in this budget?
Yes, Rider 36. And it's calling for $830 million in cuts. And, I mean, it's reminiscent of Rider last session that called for the cuts for the therapy services. So my question is, are we going to ensure that we don't have some harmful effects flowing from that?
Yes, I'd be happy to go over the various cost containment initiatives in the budget. It's Rider 34, and it's $350 million in GR and $830 million all funds. And the majority of that $350 million GR, 250 is increased efficiencies in contracting. And the senators in the healthcare work group, as well as Representative Giovanni Capriglione on the House side and other members, looked very carefully at the dollars that just flowed through the various contracts in our state. And that might sound like a lot of money, and it is $250 million, but it is less than 1%. And there are ideas, and there's a very long rider in the budget about how to generate those savings in contracts, such as competitive bidding is one area. The other aspect of the cost containment rider, Rider 34, includes increasing fraud, waste, and abuse recoveries. The third is a third-party recoupments for 23 million GR, and increased third-party recoupments, including increased recoveries from private insurance policies. And then the fourth part of Rider 34 is reimbursements for dual eligibles, removing remaining exemptions for when the state pays providers of dual eligibles the difference between Medicare and Medicaid. So there are cost containment initiatives. I think they're fair and well thought out and appropriate. I think every budget that this state does needs to have cost containment initiatives that are based upon what we as a body, as senators, as legislators, find out through the interim and find out through the budgeting process that, hey, this is an area that might need to be adjusted and addressed through policy. And this is the chance that we get to do that.
Right.
A budget is not just about adding money. It also, in some ways, should also be looked at as a way to find areas to diminish expenditures.
Sure, no, I understand that. Well, again, thank you for your...
And finally, thank you, sir. There's one other cost containment rider, and that is reducing the risk margin from 2% to 1.5% for the majority of the MCO contracts. That will save the state $76.3 million. All
right. Well, again, thank you for your hard work on this.
Thank you, Senator
Mr.
Rodriguez.
President.
I appreciate your fine questions, sir.
Yes, sir.